Hello, everybody. Welcome to MHTV. We're really pleased to have you with us tonight. And we're going to be talking about CAMHS nursing, particularly thinking about roles and role identity within that. So we'd love you to join in with us. So before we come to our fantastic guests, let me hand you over to Dave and he can tell you how you can join in with us tonight. Dave?
Hi, everyone. Yeah, thanks, Nicky. As always, great to be joined by you. And you've got a couple of ways you can join in tonight's conversation. The first is on the Facebook live feed. Obviously, you're watching the video. If you just head towards the right, there's a bit where you can type in your stuff. Questions, comments, love to hear them. And obviously, we'll bring us in as many as we can tonight. The other option you've got is if you want to use Twitter, and all you need to do to make sure we see those tweets is to use the hashtag MHTV. I'll be searching for them as the conversation develops tonight. And again, I'll bring in anything that I can into the chat that we're having. But without further ado, straight back to you, Nicky.
All right, so let's introduce our guests. First of all, Anne, can you tell us a little bit about yourself?
Yeah, hi, Nicky. So I'm Dr. Anne Cox. I'm a nurse consultant who works in CAMHS in Midlands Partnership in Staffordshire. I've been working in CAMHS for on and off for about 25 years. So I actually started my career working as a healthcare support worker on a children's ward. So I've been invested in children for a long time. Yeah. So I'm very passionate about mental health nursing in CAMHS and obviously why we're having this conversation today.
Thanks for being with us. And Grace, how about you?
Hi, Nicky. My name's Grace. I am a practice development facilitator at the Foundation of Nursing Studies currently, and a very proud mental health nurse. I've spent most of my previous career before I came to this role working in adult mental health, but as the, I suppose, the go-to for transitions from CAMHS and also mainly working with young adults within the adult team. And I'm, as I said, I'm a very proud mental health nurse and always happy to talk about mental health nursing.
Lovely. So for anybody who is tuning in who's not sure what CAMHS actually is, can you give us a little description of what we mean when we say CAMHS, and then we'll go on to talk about CAMHS nursing.
Yeah, so CAMHS stands for Child and Adolescent Mental Health Services. So I think historically it was probably seen as what we class as a tier 3 specialist service, so like a community service of CAMHS, and then there used to be an additional inpatient service. And I think historically that's what it used to be, but now CAMHS has kind of transformed into it being a whole kind of whole system of anybody who is supporting children with well-being and with mental illness. So that could be, for example, from our GPs in primary care, nurse practitioners in primary care. It could be mental health support teams, which are based in schools. It could be people that are working in education for pastoral care, and also the specialist kind of CAMHS services that we offer. It would include school nursing. It would include anybody really that's going to have a intervention or a interaction with a child that is being supported for well-being or mental health difficulties.
What age range would we be looking at for CAMHS?
So we would usually say that it's between 0 to 18. However, usually within specialist CAMHS services, we're probably looking at 8 years and above, because we would advise under that normally they would have support from other agencies, such as children's centres, school nursing, and those kind of interventions. The mental health support teams also support 5 and above. Within the NHS plan, it's looking to move towards 25 years. And certainly in some of the early intervention teams, which look specifically at supporting young people with psychosis, they start at 14 and they finish at 35, I think. So there is a kind of range of age ranges, but on the whole, within specialist CAMHS where I work, we would see probably 7 to 8 years up to about 18.
Fantastic. That makes a lot of sense, actually, when you're thinking about the transitions that people go through. So thinking about the identity of CAMHS nursing, because we were obviously all, as you've all said, you've all talked about, your experiences working in adult nursing and adult mental health, and now you're talking about the kind of fact that you've really dedicated and focused in on CAMHS. So maybe we can think a bit about why nursing identity matters, but what's specific about CAMHS nurses? What skills do you think that are slightly different maybe, or that separate you out?
I think, sorry, go on. It's okay, go on.
I was just going to say, as someone that can celebrate it from the outside in, I think one of the things that CAMHS nurses do that doesn't necessarily happen once you get to adult services is that real balance between developing a therapeutic relationship both with the young person and with their parents, and being able to balance having that safe space for the young person, but also, you know, working with families. And that is a real skill to master. And I think it's massively worth celebrating because CAMHS nurses do it brilliantly.
Yeah, and I think one of the challenges is there aren't any direct routes into training to be a CAMHS nurse. So you could be, the 4 branches of nursing are obviously children's, adults, mental health and learning disability. And what we see in CAMHS is we have sometimes all of those branches of nurses working within CAMHS. I think from a mental health nurse perspective, some of the challenges are that there aren't mandatory placements for CAMHS. And so to try and help somebody understand what it's like working in CAMHS, it can be really difficult. And I think that's something that we're advocating for, is that we do have mandatory placements within CAMHS so that we can help others understand what CAMHS is and how it works, because it's quite different to adult services in the philosophy of how we provide intervention and support for children and families.
Okay. So on what way would you say that is?
So going back to my student days, because that's probably the last time that I worked in community adult services, my experience was that it would either be a kind of clinic-based model where you might have some people that are coming in for particular medications, medical model, or it will be going out kind of just touching base with people in the community, going to different homes. And whilst you might provide some level of intervention, the interventions were quite short. So you might be expected, for example, to see 2 or 3 people in an hour, something along those lines. In CAMHS, it's based upon offering therapeutic intervention, evidence-based intervention, such as CBT-informed ideas, so cognitive behavioural therapy, dialectical behavioural therapy, systemic family therapy, interpersonal therapy. So there's lots of different kind of evidence-based interventions that we would use. And generally our appointments are systemically driven. So it may be that even if we spend some individual time with the young person, we will always consider the system that child or that young person is in. And that's really important because that influences what's going on for that young person. So our appointments will probably look more like an hour, offering that level of intervention, and over several weeks, probably weekly for some. For those that are doing a little bit better, it might be fortnightly. So it feels like a really different philosophy in the way that we work. We work in a multi-agency approach. So we work with school, we'll work with social care, we'll work with whoever we need to support that child to help them move forward with their difficulty.
And I think it's always a bit of a shock when people kind of reach adult services, because there are a few things that kind of change your life overnight. Turning 18 isn't really one of them. You know, you're the same when you're 17 and 364 days. I don't remember how many days there were in a year then. As 18, and it's different. I mean, I was lucky enough to work in a service where I got to do that therapeutic intervention, but I know it's quite unique within adult services. A lot of the time it is around kind of coordinating care and not necessarily offering as much of that therapeutic intervention. But I suppose all of a sudden they can decline their parents knowing, or guardians or carers knowing anything. So it's a big shock, culture shock as well to parents, carers and the systems around. And there's also different things that CAMHS focuses on that adult services don't tend to. So the neurological difficulties as well, tends to be commissioned by CAMHS services, and then all of a sudden at 18, there's not really a service for it, which can be really, really difficult.
Yeah. And another thing you guys were both talking about was this fact that you're working so much in kind of multi-agency roles. So what does a nurse specifically, or mental health nurse specifically, bring to working with children and young people?
So I kind of like the phrase nurses kind of are the therapeutic glue, really, that kind of hold the multi-agency together. So I think nurses are really skilled in being excellent communicators. I think they're able to communicate on several different levels. I think they've got the knowledge and skills of mental health intervention, but also the knowledge and skills of physical health understanding to be able to bring all of that holistic biopsychosocial assessment together. And I think that's what we do really well as mental health nurses.
Yeah.
I think, unfortunately, some of the challenges of that in CAMHS is the current CYPI app strategy, which is a strategy which encompasses all CAMHS within England. And it's a transformation of services to be able to become more psychologically informed using better evidence-based practice based on 5 principles, which include supervision, access, participation, evidence-based practice. But what it's lost out of that is the value of nursing within it. So there's a lot of training to be trained into psychological therapies or psychological practitioner level, but there isn't anything about developing nurses within that. And I think that's been a real shame. So I think nurses have had a really hard time over the last few years because they've not been recognised for the role of what they actually offer. And nurses really are that mainstay of being able to kind of care coordinate, if you like, and bring all of those agencies in together whilst offering the intervention to the child and delivering that evidence-based intervention to try and support them to a place of better management or wellness.
Yeah, and there's no other person that does that within the team, is there? If you think about kind of all the aspects of CPA, the nurse is the person that brings all those together, taking elements from other professionals, but brings those together. And no other professional does that.
I think sometimes one of the reasons we can struggle is because we're so able to bring in all these different skills. It can sometimes, when you look at what's distinctly nursing, that can look, people can just say medication. You're like, oh. So there's something about kind of being able to work holistically, which I think is really interesting. It's really exciting. It's one of the things I like best about it, being able to look at the whole picture. I can remember another conversation we've had, Anne, so I don't know if you can remember me talking to you about it and you talking to me. It was about this erosion of nursing pride a little bit when you were talking about therapeutic glue. It reminded me.
Yeah, and I think we've kind of lost our way a little bit in mental health nursing, and I don't think that's particular to CAMHS especially. I think it's across the board. And I think sometimes it's really difficult to define what a mental health nurse is. You know, how do you define that to the public? How is that different from another profession or a therapist? And I think helpfully things are changing. You know, I think recently Grace and I have been involved as part of the 50,000 nurses commitment, the mental health subgroup, with a number of other professionals and patient advisory forums. And it's been several meetings over several months and kind of little focus groups, if you like, to look specifically at one area of nursing. Grace and I look particularly at children and young people. And actually, it's really sparked something within us to say that we absolutely need to raise a profile of mental health nursing. And I think some of that has been the strategy that's not been helpful. I also think that we've, like even retaining the title nurse within a job title, for example, has been eroded. So a lot of the times you might get, they're a mental health practitioner or they are a care coordinator, but they're not a nurse. And I think we need to bring that profile back, and we need to raise the profile, because actually nurses are fantastic professionals and they do something that no other profession does. So we need to hold on to that and raise that profile to make sure that that erosion is kind of almost turned on its head, so that we all, do have a better profile, but also that the public understand what we do, because I don't think we sell ourselves very well. And some of that is, I think, because of the pressures that are in services at the moment. It's really difficult, isn't it, when you're trying to, we've had a pandemic, whilst a lot of the focus has been on physical health, there's been a pandemic within mental health as well, and we've never shut either. And I think we're just seeing the kind of after effects of that now. So I think we've got a real opportunity to show what we can do and really raise that profile and value of nursing.
Before we come to Grace, can you just be really just clear and clarify, what is the 50,000 nurse commitment for people who haven't heard of that?
So the 50,000 nurses commitment was, I think, an agreement by the government that that's what they were going to commit to in order to increase numbers of nurses, because this is the number of nurses that they said that they needed in order for the NHS to be able to sustain itself. I think it's probably far short of what we do need, but it's a good start, and we need to, use that helpfully. So as part of the mental health contribution, there was a number of focus groups. So there was ours, children and young people, there was population mental health, and then severe mental health, which looked at particularly at adults. But I think the conversations were so empowering, I think, really, to be able, it was just such an energy that has been driven over the last few months to deliver these three kind of papers and recommendations of what we needed for our particular areas. And I think hopefully we're going to take that forward. So it's really good today that Grace and I are on so that we can talk about some of that. But I think within our nurse consultant forums, within the Mental Health All England nurses plan, there are things that we can do to start driving that forward from a local level, as well as the document that we produced has been all pulled together, and that's going to be submitted to Parliament as well for the politicians to think about.
Grace, is there anything you want to say before we go over to Dave?
That it's great that celebrating that we're nurses, we should be introducing ourselves as nurses, and the more people do that, the more we get recognised. I've introduced myself as a nurse before, and people, even though they've come for kind of a mental health assessment, don't really know that mental health nurses exist, don't know what we do. And as Anne said, it's not just in CAMHS. I think it is more prevalent in CAMHS that the title nurse gets eroded, because as Anne was saying before, there's a lot more people become therapists, and then nurse kind of goes away and therapist is there. And what does that have on your kind of identity as a nurse? But we are employed as care coordinators or mental health practitioners, and you could be any profession. But yeah, we should be celebrating we're mental health nurses.
I think there's a lot of reasons that happens. And I think one of the things, and I've come across this, and I don't know if it's true for you guys too, is that when you're working with HR, they would rather have an open title so they don't have to keep advertising if they can't get hold of a nurse. And this idea that you draw from the biggest field possible, which is okay, as long as you're not looking for specific skills. But I
think that's it, isn't it? I think that's the trouble, really, that nurses do bring a unique skill. They bring unique set of interventions that they can use. They are trained professionals in what they do, and I think that's the difficult, because there isn't enough nurses and we're all fishing in the same pool for recruitment. I think we need to think differently about recruitment. We need better career structures, we need better support for continuing professional development to be able to retain the nurses that we've got and raise a profile. It's really, I think if we had a better profile and we really valued the nurses that we had, which we do intrinsically within our own areas, but it feels like from a public perspective, I think we need to improve that. Then I think we would have more people come and train as nurses. I mean, I think the increase in nursing has been terrific for the pandemic in terms of recruitment into student nurse positions. But what is that going to look like in 5 or 10 years' time? I mean, I think our time in CAMHS is probably coming now in terms of our pandemic, and what we're seeing in terms of long COVID type presentations that are presenting as psychological presentations, so whether that's OCD or whether it's, you know, kind of PANS, that kind of thing, which there seems to be an increase in those. You know, nurses are critical to be able to not only assess but, you know, diagnose that and eliminate the physical health causes before taking them down a treatment of mental health intervention that might not be appropriate for them. So I think we've got a real opportunity now to come into our own and yeah, as I said before, develop the kind of profile and value of mental health nursing in CAMHS.
Definitely. I'm getting questions through, so I'm sure Dave is. Dave, can I ask you if you've got any thoughts on that? If there's anything you want to share with the audience have brought up?
Yeah, absolutely. And I suppose just as you've been speaking, thinking back to my own kind of history of working with colleagues in CAMHS, obviously, you know, Nicky likes to remind people now and then that I am a health visitor, not a mental health nurse. So I've had kind of quite a lot of involvement with CAMHS. I think one of the really frustrating things from kind of my experience in practice was how difficult it was to get children to access CAMHS services. And that kind of, it was always you'd write a referral and you'd get a bounce back because it was never kind of serious enough. I think one of the things that came out a few years ago was a report from the Children's Commissioner in about 2016, and it just highlighted how severe children's presentation needed to be to get a CAMHS referral and to get that accepted. I suppose, do you feel that that has sort of changed positively since 2015? Or is it kind of still very much sort of high need, high tiered services that, you know, people get access to services?
So I think there's been a lot of work put in. You know, we've had the mental health support teams, for example, from the 2017 Green Paper that is looking to cover, I think it's 100% of schools by 2024, which is a fantastic investment. So when we move away from the tiered structure of CAMHS and just thinking about specialist CAMHS, and we move to thinking about a whole system CAMHS, so we're talking about primary care, schools, social care, that kind of thing, then I do think there's been a lot of investment within the system, and there's certainly been investment within psychological, kind of low-level psychological provision across the system, which should meet the needs of those children earlier. So they shouldn't need to come to specialists in old money tier 3 CAMHS. I think the bottom line, it's always about resources, isn't it? We absolutely can work smarter. I think the commissioning of CAMHS is a hodgepodge across the country. There are no two CAMHS services that are commissioned the same. Sometimes even CAMHS services are commissioned by 3 or 4 different commissioning structures. So it's really difficult to get any consistency. And I think that's what CAMHS needs nationally, is to have that kind of set commissioning so that we've got that level of consistency, because you'll get in some areas, for example, you know, you've got 4-year waits in some areas, and then you might have people that are meeting their 18-week targets in other areas. So it's really inconsistent, and I really understand how families find it so difficult to get the support that they need when they're so desperate and the information isn't out there to support them. And so for them, it's their crisis, absolutely. But for us, in terms of what we're dealing with at the moment, the level and acuity, the level of safeguarding that we have, especially since the pandemic, has just been astronomical, really. You know, and clinicians are tired. and the result, there are recruitment going out there. They are trying to recruit, but it's just so difficult to get people to come in. So we need to, and I think in some areas CAMHS has got a bit of a bad reputation. I know there's kind of a move to kind of move it to CYP mental health, for example, but whatever you label it, you've still got to change the inward workings to make it work for our children and families that we serve.
Yeah, it's a classic mental health strategy, isn't it, to just relabel something. Oh, we're not having rehab, we're having recovery now. Nothing is different.
It's not fundamentally, it's not going to change it. But I think there's been lots of improvements since 2015. However, it feels, I think, when you're on the shop floor, it's a bit like a drop in the ocean. We had a lot of different So many years ago, although there's probably still available in some, we used to have primary mental health workers that used to be band 7 clinicians that would be working maybe in 3 or 4 schools. So they would offer mental health support within 3 or 4 schools. Now we've got the mental health support teams, and that might be a team of 4 or 5 that's covering somewhere between 16 and 20 schools. So in terms of whilst they offer a brilliant job, and I've supervised a lot of the mental health support team, the education mental health practitioners, and they're fantastic, they absolutely are, but they're very narrow in terms of what they offer in respect of, it's quite linear, it's quite a CBT type of low level approach, but then a whole school philosophy alongside that. So there are definitely good elements, but I think we've also lost stuff from the past that was actually really good as well. And I think the balance will be bringing all of that back together, I think, and increasing the resources that we've got.
Yeah, and I think there's the resources in terms of the commissioners, but also the recruitment, and it comes back to that. Actually, it can be quite difficult to get a CAMHS placement if you're interested in it. It certainly was when I was doing my programme. And I don't think that's changed. And actually, people are, they're doing the nursing program, and then they're coming out and they've not had any exposure to CAMHS. So why would they try and work there? And that's where it kind of comes down to, getting that exposure in some way, whether that be through, mandatory placements, having young people and carers coming into the universities, virtual placements. There's lots of different ways that exposure can happen within their nursing journey at the start.
Absolutely.
I suppose I need to give a shout out to sort of the work that our organisation's done. Obviously really concerned about the number of school nurses out there, that we've seen a pretty dramatic decline, and also more recently in the number of health visitors, both professions that absolutely kind of complement, rely on, support, work together with CAMHS professionals. And, it's such a shame that we've kind of seen that. And I know when we saw the previous government paper on children and young people's mental health, just feeling that it wasn't ambitious enough, that actually, we do need lots of support in schools, that, teachers have skills to teach, but, they often don't have enough skills to be able to support what can be really kind of complicated and difficult mental health issues for children. And actually, we know that the professionals from CAMHS, from health visiting school nursing, can absolutely make a huge difference to that, and how critical it is. I think, obviously, you both spoke really eloquently tonight about the work of mental health nurses in that, and that's really positive to hear that. I think the other thing that I wanted to emphasise was, there are lots of other professionals that are involved with children, but none of them get to be the top kind of professional that's recognised by the public to be the most trusted. And nursing isn't, every time nursing comes out, to be that most sort of respected profession. So something to really hold on to positively. Now, we've had quite a few comments. I'm sure Grace will be glad to know that Joanne Bosen-Kay has made a comment. Obviously, I think she's your boss, so that's always good to hear, isn't it? And she said, and it's long-term sometimes too. You can really influence young people's life. What an honour to be in that position. So obviously, shouting out praise for mental health nurses in CAMHS. We've also had Sophie say a mental health nurse would develop a therapeutic relationship based on trust, understanding and acceptance. Rosemary's commented that she's here to learn tonight. She's a mental health nursing student. What better place to come to than MHTV to get that learning? And we've also had Alfonso, a regular viewer. Many of my students ask me, how do you become a CAMHS nurse? Do you need additional qualifications or training? So a great question for you to get your teeth into then, Grace or Anne.
Yeah, so historically, there always used to be this kind of caveat. Well, if you didn't have 5 years kind of post-reg experience, then you couldn't come and work in CAMHS. And there's still this niggle that people seem to think, well, if you haven't got children's experience, then you can't come and work in CAMHS. Well, actually, you can come and work in CAMHS. It's about transferable skills. As we said before, there are no direct routes into working in CAMHS. There is a push at the moment to provide some post-qualification training, like in a module of CAMHS at some universities. So I'm currently working with Keele University to kind of develop one of those. There has been some in the past, but some have kind of dropped off. So there's an ability to kind of learn on the job, really. But I think, you know, as long as you can demonstrate those transferable, we've all been around children, you know, we've all been around families. So use that experience, even if from your own personal perspective, and look at your transferable skills that you've got from a nurse and how they can be used within CAMHS. You can certainly learn on the job. You know, I came from, although I started as a healthcare support worker in children's originally, I went into adult services and then went into forensics before I moved back into children. But so I think there are lots of different ways in, and I think we're very open now. As I said before, we've got all branches of nursing within. One of my closest colleagues is actually an adult nurse, and she started her career working in intensive care in adults on an acute service, then went off to do a school nursing, and now has come into CAMHS and is a CBT therapist and an EMDR therapist, but is a nurse centrally, and that's the important thing, because that's the thing that carries you forward. So where whatever branch of nursing that you're in, there is something in CAMHS for you, absolutely.
And you can ask, see if you can get a CAMHS placement. If you can't get a full placement, ask to spend a day or two with them to see what it's like, and experience that with one of the nurses that works in CAMHS.
Yeah, and in education, mental health support teams, even in social care potentially, and as long as you've got your supervisors there, you should be, you know, it's thinking about CAMHS as a wider system. And I think we really need to move away from thinking it of just a specialist CAMHS now, which I think is a helpful way of thinking about it. But absolutely, yeah.
Well, and we've had a comment from Steve, who I know is a paramedic. He just reflected on something that you said about career pathways and progression opportunities are a great magnet for recruitment. Nothing worse than feeling pigeonholed or in a dead end with no prospect of betterment. So, you know, just a more sort of general comment about that. And also, Steve, thanks for the happy birthday wishes. Got to get that in.
Oh, happy birthday, Dave.
Happy birthday, Dave. You kept that quiet.
If there are more comments, I've got a couple of questions if you haven't, because I can see we're already at past.
They were the Facebook ones. I'm going to take a dive into Twitter now, so I don't know if you want to take over, Nicky, while I look there.
I've got one here from Ada First Year saying, what one thing would you change about CAMHS services? Which I think sounds like an easy question, but I think might turn out to be quite a hard one, because it's just one thing would you change to make it better. And I've got another one here from an adult nurse who's actually saying, what can CAMHS nurses teach us about, it's quite a long question, I'm paraphrasing, so I do apologise. What can CAMHS nurses teach us about taking care of our children at the moment? And my kids have obviously been through COVID like everybody else is, and it's been a really difficult time for them. So 2 tiny questions there for you. Pick them in any order.
I think for me, it'd be, and this is obviously just because of my experience around that transition, it's different wherever you go. Sometimes you get that kind of transition team between the ages of kind of 16 and 18. Sometimes it goes up to 21, but to have that period of transition rather than going straight from children and young adult services to adult services right on that dot of 18, I think that could definitely be improved.
And that's been a long-term issue that we've had, isn't it? It's been a long time. And the other thing just to bear in mind of that for anyone who's listening is it's the age where a lot of things change. So things around finances will change, things around if someone's a looked after child or something like that, all those sorts of things are changing at the same time. And I don't know if anyone's can remember back to being that age, but it's just horrible anyway. It's a really traumatic time anyhow.
And that brings me to something else to celebrate with CAMHS nurses and mental health nurses. It's that knowledge of child development as well, which we don't have so much within adult services because
we don't put the priority on it.
Really people are developing all their lives, but up until the age of 25. But it's particularly significant in that time. And what's the difference between a severe mental health difficulty and child development, and picking that out.
And what one thing would you change? And then we'll come back to the Support through COVID question.
There are lots of things that would change, but I think one of my absolute bugbears is postcode lotteries. So I'd really like commissioning to be equal across the NHS and third sector agencies and school nursing and health, so that it's equal. So wherever a child is in England, that they all get offer of the same service.
Absolutely. And what about kind of say hints, because that makes it sound tips and things, makes it sound a bit shallow, doesn't it? But what one thing would you share maybe from your practice for anyone who's got kids at home who've been through such a strange time? The last probably 3 or 4 years have been really quite odd, and they don't look like they're going to be changing from being stressful anytime soon for that particular generation. What could you offer in terms of how to support people, young people?
I think it's okay to not be okay. It's a really difficult time for everybody and lots of people are struggling. I think to try and keep some level of routine is really important. To try and keep connection with other human beings is really important. And I think because our lives have been so turned upside down, that there are going to be things that are different now. And just because things are different, so for example, during lockdown, we had a lot of referrals saying that kids weren't sleeping, for example. They weren't, or they were becoming a bit more hyperactive, but they weren't exercising. They were spending long times watching the TV or on the iPad. They weren't getting enough physical exercise. The diet's probably changed. I think just keeping those fundamental things, keeping hydrated, doing different activities is really important, just to try and keep that structure on a daily basis, and that we're all not okay, really. I think it's affected all of us in some way. Kids are resilient though, and I use that lightly because I don't think we should be expecting more from children than what they should be able to offer, but I think they are flexible in the way that they're able to cope and adapt with things, and the hope with the security and safety and nurture from the people around them that they will get through this.
Grace, is there anything you want to add to that?
I think it's just around that kind of, is this a normal response to a really, really abnormal situation that we've all been through? And we all have feelings, and feelings are normal, and we have them for a reason. And sometimes when we feel those negative feelings, we just want to get rid of them because it's not very nice. But actually, sometimes you just have to sit with them and let them be for a bit and not try and change them, because actually it's been a really tough couple of years, and we've all had periods, where we couldn't sleep or watched too much telly and done things like that. So it's sitting with those emotions for a bit, but obviously reaching out for support when that becomes too much.
Definitely. And we're nearly at time now, so I'll just come to Dave to see if there's anything else that's come through in terms of questions or comments.
Well, I've been too busy clicking on links and stuff and typing stuff, so I may have missed stuff. Sorry.
Right. Don't worry. And Grace, is there anything you particularly wanted to come to before we finish up? Because we're going to finish up shortly. While Dave's checking away.
I think I'm really pleased by the focus groups that we did, because I think it's given some energy to a lot of people to be able to kind of do something in changing the profile of nursing. So I think anybody who is interested in doing nursing, and especially working in CAMHS, do just reach out, ask your local CAMHS service whether you can have a placement, ask to come and spend a day with somebody, or what's it like working in CAMHS. We are open to those things, even pre-nursing, really. If people just want to know what it's about, linking with your local university where they've got their nursing curriculums on, and just have a look. Because it's a really rewarding career. And I think one of the benefits of working with children, I think as Joanne had said on the comments, is that you've got a real opportunity to change a child's life forever. And what we make out of a child, they're going to be better adults. So you've got a real impact in what we do.
Absolutely.
And I hate to quote songs, but children are the future, aren't they?
I am so
great quote, though,
you did not sing that. I think you really missed an opportunity there. Yeah, absolutely. So it's about investing, isn't it? And I think this is a time where we need to be hopeful and optimistic. And we say a lot more with our actions than we do with our words sometimes. And when we divest these services and neglect the staff of them, we're giving a very clear message about how we think things are going to turn out. Because you need that support to do well, to do a good job of looking after children and supporting them. Anything else, Dave, before we finish up?
I suppose just another kind of final thought for me in terms of the importance of that, the kind of the whole process of childhood. Obviously, as a health minister, I've been so invested in the importance of the first 1,001 critical days. And there's such a big movement there, kind of talking about how critical it is to do, really important work with the children and families. And like you say, I've spent lots of time talking to politicians who want to kind of argue, how do we make things cheaper and cheaper? And actually, if we absolutely invest in this period of people's lives, the returns that we get, not only sort of in cash terms, are so huge, but actually more importantly, that I'd rather live in a world where we spend a lot of money on just making sure kids have lovely lives, it's just such a valuable thing that we can do. And I think it's a shame at times that, children are particularly let down by legislators, maybe because they don't, vote, maybe because their voices are often a little bit quieter. But how important nurses are, and especially CAMHS nurses, in getting those messages out to legislators and encouraging them about why this work's critical. And I think, again, the work that Grace and Anne's been involved in, I was involved in as well with the 50,000 mental health nursing group. It hopefully will sort of reap some benefit, including in the CAMHS field, and we'll just carry on that fight, really, won't we?
Absolutely.
Yeah. And we've touched on some legislation and things like that, so we will tweet it out, and there's recommendations you can have a look at. You've had as well a lot of suggestions about approaching your local CAMHS services, and actually, if you have an interest in this area, absolutely following up on it, because people will be pleased to see you. No one's gonna be like, you can't come in. People want to grow more nurses and know there's a lot of interest in this area, which is why we came back to it. So please do let us know if you have any questions. You can always tweet them or put them on the Facebook, and we will cycle back to them, because we do check in a couple of days later. I think other than that, it just remains for us to say good night. So good night, everybody. Thank you for joining us today. It's been a real pleasure. And it's gone super fast. So thank you all. Good night.
Night.
See you next week, everyone.
Bye-bye.